Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then colloid nodule. So if the patient presents with colloid nodule, then in colloid nodule, most of the times we should observe the patient. So if there is colloid nodule in the patient, we should do observation. Along with we should do a serial ultrasonography, and even thyroglobulin can be measured serially. Now, while you are observing, and at one point, if the thyroid nodule enlarges, if the colloid nodule enlarges, in such cases, if the colloid nodule enlarges, then we should repeat the FNAC again. We should repeat fine needle aspiration cytology. Then, so you will have, if the thyroid nodule enlarges, you should do an FNAC. Along with that, we can give an L-thyroxine therapy. Is given L-thyroxine therapy is given such that TSH levels should be between 0.1 to 1.0 units per ml. We should give thyroxine therapy such that the TSH levels should be 0.1 to 1 units per ml. If you give thyroxine therapy in such way, we are actually suppressing the TSH suppression. This regimen is achieving the TSH suppression. So, whenever there is TSH suppression, on TSH suppression, almost 50% of the nodules will decrease in size. They will decrease in size with this TSH suppression. That is, if you give the L-thyroxine in the dosage of in the dosage such that TSH levels are 0.1 to 1 units per ml, this treatment will decrease or regress almost 50% of nodules, and this is most effective if the nodule size is less than 3 centimeters, then this treatment is most effective. But then if in any case, if the nodule enlarges on even on TSH suppression, you have done TSH suppression, that is, you have given thyroxine in the dosage such that the TSH is suppressed, but even after giving that, if the thyroid nodule enlarges and it causes compressive symptoms, by compressing either the trachea or esophagus, or if it is not looking properly, or it has some cosmetic issues, so in both these cases we can do a hemithyroidectomy is preferred in the patient. So we do hemithyroidectomy if the nodule is enlarging on TSH suppression, and if the nodule has compressive symptoms, then you do hemithyroidectomy. Then we can also do total thyroidectomy. When do you do total thyroidectomy? So what are the indications of total thyroidectomy? Total thyroidectomy is done in conditions if the patient has previous history of irradiation to the thyroid gland. If the patient has previous history of irradiation, that means he has increased incidence of thyroid cancer. So we do total thyroidectomy. Similarly, if the patient has family history of thyroid, even then there is increased chances of thyroid cancer. So we do total thyroidectomy.
thank you and thank you for watching.